Our next speaker, who is Dr. Leana S, our new City Health Commissioner. Dr. Wen has many ways to introduce her. She is a Rhodes Scholar. She's an emergency medicine physician. She has written books and given TED Talks. But what I would say is that she had a great career at George Washington. She was well known. She was had 3 times as many Twitter followers as me. And she did not need to take on the challenge of being the Baltimore City Health Commissioner. I know that, having been involved in the selection process, she had to make a decision to commit herself to the work of public health in the city. And she not only made that decision, but she has put herself all in. She has gotten engaged. She was here when the measles outbreak happened with all the leading pediatricians in the city on vaccination. She has been deeply engaged in the events of the day, as you may have seen her delivering medicines. We at the school are so glad that she is in her position, and we are building a very strong relationship with her to support the work that she's doing with the city. I want to especially thank Kevin Burns and all of the students who responded to her call for help, staffing hotlines and going door to door in West Baltimore. But none of that would have been possible without her leadership, and I think it would be a huge understatement to say she is not exactly slowing down. So with that, it is my great pleasure to introduce Dr. Wen.
Well, good morning, everyone. So I came in at the very end of Congressman Cummings' presentation, and I thought there is no reason for me to be here anymore, because all of you now, this is why we're in public health, right? I mean, I think he gave the strongest endorsement that I've ever heard of why it is that our work today, why it is that all of us being here is so important. And so I just feel extremely fortunate to be part of this group, this gathering today in your conversation. And I want to thank Dr. Sharfstein for his leadership, Dean Clagg, and so many of you for all your work in the school, but more importantly, in the community. So I want to take us back. As Dr. Sharfstein mentioned, I'm new to my position. I came here about 4 months ago. It's been an interesting ride so far with a lot of things that have happened in the city. But I want to take us back because my training is as an emergency physician, and I still think that the most important work that I do is patient care and the one-to-one interaction with my patients. And so I want to take us back to a story of one of my patients. I want to tell you about Sam, who's 25 years old, who was in a car accident. It was the middle of the night. It was dark. It was raining. There was sleet. There was snow. There was a lot of ice. And his car, while he was on the highway, struck the median and flipped over twice. And it took the paramedics about half an hour to extract him. So Sam came to us in the ED as a co-trauma. And we had a lot of people there. We had emergency physicians, we had surgeons, we had nurses and techs and x-ray folks, and everybody was ready to go because we knew what to do. And so when the ambulance pulled up, we were all there, gowned and ready to go. So what do? We check his airway, we check his breathing. We take off his clothes and we put him on a monitor. We establish 2 large bore IVs. We assess him from head to toe. We get x-rays of every bone that we can think of. And we send him over to CT to look to see whether there's internal bleeding. So how many of you in this room are pre-med or medical in some way? Anybody? So quite a few people. What do we forget in all of this? In the trauma survey, what else? What did we forget? Well, I want to take us back to something that Congressman Cummings said at the funeral of Freddie Gray just over a week ago. And he asked the question, did anyone really know him? Did anyone see him? Did anyone say hello to him? And in this case, what we all forgot in the midst of all this trauma and everything else was going on was what to explain to Sam about what was happening to him in that room. Now, I have no doubt that medically, the doctors were trying to do the right thing, right? Because Sam was actually really ill. I mean, we were worried about his health. He could have had broken bones, he could have had bleeding in his brain, collapsed lung. All this is true. But you know what? Sam was awake. And to this day, he'll tell you that he remembers every moment of what happened to him that day in the emergency department. And you know what he remembers? He'll say that what he remembers is that day, there must have been a lot of stuff going on because everyone was so busy. They were running around him, talking to each other. They were so busy that they didn't even have time to tell him before they ripped off his clothes. They were so busy that they didn't even have time to say hello to him and explain to him what was happening. Now, I tell you the story not because nurses or doctors or techs or any of the other people that I've worked with over the years are bad. And actually, I have an admission to make, which is that I was one of the doctors who took care of Sam that day. And I'll tell you that we were focused solely on him and on what was happening to him. And we were so busy trying to take care of him medically, though, that we forget how scary it is to be in that moment. Imagine if you were in a car accident. You don't know what's happening to you. You don't know what's going on. You may have passed out at a certain point. You're in pain, and now you're getting poked and prodded and have no idea what's happening to you next. Now, I tell you the story because there is a disconnect between what it is that our patients experience and what it is that our system is actually aiming to do. And again, this is not out of malice in any way. This is never born out of a bad will. But what I saw in my medical practice is that we are pretty far from practicing what we know to be true patient-centered care. Now, I want to bring us back to the community as well, because this is another part of what we're talking about today with what is community-centered care, what does community engagement mean? Well, I'll tell you what this does not mean, and I'll tell you another embarrassing story from when I was a medical student. I worked as a community organizer in St. Louis, and I was bright-eyed, bushy-tailed, came into this community working on sickle cell anemia. I was so excited about handing out all these flyers and engaging the community. And so I remember passing out these flyers, and you know what the first question that I got was, what candidate are you supporting? Right? People thought that I was distributing the flyer for that purpose. And the second question, if I said I wasn't supporting a candidate, was, oh, this is another survey that you're giving me. What is this survey for? And I see the same thing in Baltimore as well, that people are so sick of us telling them what it is that they need. People are so sick of us saying to other people what it is that you can bring to me, not how can I best to serve you? From my perspective, too, I was a caregiver to my mother for 8 years before she passed away from cancer. And we saw the exact same thing in medicine as well, that we saw so much of the medical system telling us what it is that we should be feeling, what it is that we should be doing, and not so much how they can actually deliver care to us. And that is certainly not the type of community engagement or patient engagement that actually breeds confidence and trust, which is what we need at the end of the day. So I know that we're here to talk about Engage Baltimore and about the events of last week. And so I thought that what I would do, is to take you through some of what happened last week, because it's a perspective that I certainly would not have known. I mean, I'm a yard doc, right? I've never worked in government until I took this job. Josh probably should have known that before they selected me. No, I'm kidding. But but I came from the world that you're in. I came from academia. I came from practicing medicine, and I didn't know what it was like to be part of the government response, the city's response to what happened. And so let me take you through to see what happened last week, the perspective that I saw, and also a few of the lessons that I learned. So I want to take you back to last Monday afternoon. I was at a meeting across town at the University of Maryland when I heard that their campus was getting shut down, that there was this threat of the purge. I mean, it seems like a really long time ago, right? But this was all last Monday, that there was this threat of a purge. Now, we have 2 health centers that are run by the city. One of them is Druid, which is 1515 West North Avenue, right in that area that was the most affected. And so our immediate concern at that moment was thinking about how can we protect our staff? I mean, these are things that I don't know that I would have thought of before taking this job, right? How can we protect our staff who are in that building at that moment? And then it was, how can we protect our other staff who are in the field? A lot of the work of our health department is going out into the community, doing home visiting programs. We run field health, which is transporting patients to their dialysis appointments, to their chemotherapy appointments. Our patients still had life-threatening issues that needed to be tended to. But what can we do to protect our staff, while at the same time also making sure that our patients are okay? So I didn't know that this was all going to come our way. All I heard was that all the agency heads, or at least certain agency heads, were getting called to our emergency operations center, which is the mayor's coordination center where all the key agencies, along with our state partners, were going to be assembled. And my first thought on this was, I don't really understand why health is involved. You think about civil unrest, you think about violence, you think about problems in the community, and when it comes to violence, I didn't know what role I would have there. And actually, that was my first and probably foremost lesson, which is that there is a role for health in everything that we do. Now, we talk about this when it comes to health and all policies, right? I mean, we talk about this when it comes to social determinants. But I think this is so true when it comes to social unrest, when it comes to turmoil as well. And as the day unfolded, our key priorities were focused on how do we secure our hospitals? Again, something I never thought about, right? But you remember last Monday when it looked like, especially if you're watching TV, it looks like the world is ending, that everything is on fire. There are talks about shootings and all these buildings that are burning. People were worried. Our hospital personnel were worried. They didn't know if they could get to work on time, get out of work on time. We didn't know if we could get our patients to be transported on time. There were various ambulance companies that we were hearing of that were refusing to transport patients to the EDs. Can you imagine that? What's going to happen to these patients? Sending them to another jurisdiction, but they would refuse to pick up patients in their homes. Our call time for the 911 system went up to 3 minutes, 4 minutes, 5 minutes. How is that impacting the health of our city? So that was one of the key lessons that I learned, that health is involved in everything. And actually that we can use many of the similar methods that we use for health in everything else that we do. And so we ended up convening daily calls with every hospital planner, every hospital CEO, leaders of our FQHCs, because just like in an emergency department code, have any of you been in codes before? Lots of people yelling, there's a lot of confusion, especially if you're the person working actively giving medications or resuscitation. You don't know actually what's going on around you. You don't see the big picture. And the person running the code has to be giving direction and giving information, even if there isn't new information to give. And I don't think I realized until then just what a critical role actually health has to play in all of this, because we understand the role of health in those immediate emergencies. Now, as things went on, of course, our focus was on safety. And when you have fire and police and everybody else there, everybody else is also focused on how can we get out of this immediate unrest period. But I'll tell you something else that we had not anticipated, that may seem like common sense to everyone here, but that we did not anticipate, which is that there were plenty of people, dozens, hundreds, thousands of people, who were not involved in the safety per se, but who were significantly impacted by the unrest. I had a woman call our office who just wanted medical advice. She was in her 60s, had 4 heart attacks before, just had received cardiac stents, and was out of her blood pressure medications and her Plavix. She wanted to know how long could she go without taking her medications. Somebody else called us saying that she was out of her insulin and was only using half doses for the last 2 days and thinking that if she stopped eating, that it would be okay. Another woman stopped using her inhalers because she was hoping to string them out for as long as her pharmacy stayed closed. Well, her pharmacy was the one, the CVS, that burned down and pen and notes. She would have been without her inhalers for a long time. We actually had to call the ambulance for several of our patients who called us in the health department because of how ill they were. So the second lesson that I learned was that, life goes on. And for many, we hear the loud voices, right? You hear the people who are protesting in the rallies, and their voices have to be heard, and I totally get that. But there are also people whose voices are not being heard because all they're trying to do is to have their lives move on. They're trying to get their diapers, their adult diapers. They're trying to get food for their children. They're trying to get toiletries. They're trying to get their insurance. They're trying to get their life-saving medications. How are we going to do that? And actually, that's when I have to commend Hopkins for really stepping in, the School of Public Health in particular, for really stepping in, thanks to the leadership of Dr. Sharpstein. We also had Dr. Kevin Burns, one of our preventive medicine residents. They were phenomenal, phenomenal. And they, and many of you actually in this room, we had dozens of people respond to our urgent call for help. I mean, we were realizing as all these came in that our staff, even though we had staff working literally 24/7, that we just could not keep up with the volume of calls that we had. And these were calls all actually for life-saving information and life-saving materials that we could not do it ourselves. And so I just have to say that we're so grateful for all of you for stepping up and really giving us a hand in this extremely difficult time, and in providing these tricky types of advice as well. As we learned from, we ended up establishing a prescription hotline that anybody could call us, and we would figure things out for them on a case-by-case basis. We learned that it was not straightforward at all because every case was different. You would think that, well, I mean, for example, we were on the call with one of our major retailers, and they said, well, I don't understand the problem because there are 25 other CVSs, like a million other Rite Aids. What's the problem? There's another one just 3 blocks down the way. Well, imagine if you're a patient in a wheelchair, on oxygen, where you don't have family or friends living nearby. 3 blocks is the difference between getting your medications and not. Right? Imagine, too, that you're someone who is totally dependent on that area, unfortunately, for your groceries, for your other supplies, and you don't know. I mean, maybe it seems straightforward to us to say to call a different pharmacy and transfer your medications. How are you supposed to know that, right? You don't have the internet. Maybe you're not savvy when it comes to calling your insurance company and getting that transferred. How are you going to navigate that? And so we realized that everything had to be done on a case-by-case basis, and many of the times we had to literally deliver prescriptions into people's hands. And that's what so many students and volunteers and our staff ended up doing, which was really extraordinary. Another lesson, something else that we didn't anticipate. So we launched our efforts, our prescription drug access efforts, last Thursday night. And then Friday morning came, and we were getting the calls that we would normally be getting, but we weren't getting them through our 311 hotline. Saturday morning came, and we were still getting just maybe 2 or 3 calls, and we knew that there were more people who needed help because we were hearing this from our elected officials, we were getting separate calls, hospitals were calling us. Well, what happened last Friday that got us drowned out in the news cycle? Marilyn Mosby, the state's attorney, delivered her address, and so even though we knew that our information was life-saving and really important to many of our citizens, it wasn't reaching the people that it actually needed to reach. And so Saturday morning, thanks again to Dr. Burns and to many of the individuals here, we actually mapped out all the closed pharmacies. There were 13 at the time, and every senior center that's nearby. And we went door to door. We went knocking on every door, and the vast majority of people had not heard about the services. The vast majority also needed our services. And since then, we've set up shuttle services. We've continued with delivering medications by hand. But I think the lesson that I learned from all of that is that we really have to meet people where they are. And it's not just lip service of we're going to some community meetings or we're going to churches. That is all important. But there are a lot of people who are not going to the neighborhood association meeting. There are a lot of people who are not going to our church meetings, and these are all people who we have to attend to, and that is the work that all of us do in public health, that we have to go to people where they are, not expect them to seek services and come to us. So I know that there's a lot of talk about what's next in the city. And yesterday, our mayor, Rawlings Blake, announced the One Baltimore initiative, this public-private collaboration that's going to be comprehensive. And some people have said, why haven't we done more sooner? Or why haven't we done more? And what exactly is going to happen? But I want to share with you a couple of the challenges and maybe ask for your advice in thinking through how we can do this as well. Until I took this job, I'm not sure that I could have appreciated the tensions that we do have. For example, we need to engage our community. We know that for all the reasons that we talked about, right? We need to engage our communities. But we also have time urgency, that Baltimore has been in the national spotlight, the international spotlight, if you will, for maybe the wrong reasons. But also we have an opportunity right now to capitalize on the energy abroad and nationally and with all of these various partners to really do something. But how do you balance that time urgency with the need to also genuinely engage our community? I think that's tricky. We also want to be visionary and aim for the stars and really talk about deep underlying problems. But how do you balance that with not over-promising and under-delivering? Because that's not what we want to be doing for our communities either. We also recognize that many of the problems are things that have taken root many, many years ago: drugs, poverty, issues with our mental health system. That's not going to be solved overnight. But what action can we take now so that it doesn't look like we're just sitting and wasting time? I wish that I had an answer, and I would love to hear your answers, your solutions to all of this. And I wish that I could have come here today with an answer. I'm not quite like Representative Cummings and how I'm able to give you something to aspire for at the end. But you know what I'm going to do? Ultimately, I'm a doctor, so I'm going to give you my final story and my final takeaway that I want you to tell me from this story. So my former department chair, when I was doing my training in Boston, is this extremely intimidating man. Harvard professor, not that the Hopkins professors aren't equally intimidating, but this was a very intimidating man who he knew that we called him the godfather behind his back, and he actually really liked that. So every few years, he would do this interesting experiment. He wouldn't shower for a few days. He would go outside, literally, he would choose some time when it was raining or snowing outside, and he would roll around in the mud. Then he would pour Listerine and a pint of vodka on himself, and old oatmeal and scrambled eggs, and he would just make himself look like as, quote-unquote, disgusting as he could possibly manage. And he would stagger into our ED. So every time that he did this experiment, there would be people, attendings and residents and students and nurses who would look at him in that state, turn up their nose, walk away, and make a snide comment. And you know what? He would remember. Not only would he remember, he would tell us. And those were lessons that, believe me, none of us who ever heard that lesson would ever forget. So since Ferguson, since Freddie Gray, we've been wearing these shirts and carrying these signs that say, Black Lives Matter. Well, we in public health know more than anyone else, I think, but just in general, we all know in this room that all lives matter. And it doesn't matter if it's black or brown or green or yellow, if somebody has mental illness or substance addiction, if it's someone that otherwise society would cast aside, we know that their lives matter. Sometimes, though, that message can get lost because our job in public health often is painted as we have to address the bigger picture, to address the needs of the community. All that's true. And we know that our job in public health is also to tackle the social determinants of health and talk about poverty and inequality. And these are such big concepts that it often becomes overwhelming in terms of the amount of work that we have to do. And our job as physicians, as people who are caring for people on the ground, also is overwhelming at times because we have to treat that trauma victim, we have to stabilize that person, we have to find every broken bone. It's true, and also overwhelming. But we can't forget that our ultimate job is to preserve the dignity and to respect the humanity of all people. To be a strong voice, to be an advocate for health, to be a good listener to the community who will meet people where they are and treat each person because their life matters. That, to me, is patient-centered care. That, to me, is community-centered care. And that, to me, is public health. It's so hard, but it's such a profound honor and privilege to be here with all of you today, to be able to serve our patients and our communities. Thank you.